Imagine enhancing your face or body using your own fat. Sounds like a win-win, right? But here's the catch. It's not always as simple or straightforward as it seems. From amazing transformations to potential risks, we're diving deep into what makes fat transfer such a buzzworthy procedure and why it might or might not be the right choice for you. Stick around. You don't want to miss this episode of the Doc Dudes.
Welcome to the Doc Dudes, your premier podcast for a behind-the-scenes look at the latest in aesthetic medicine. Hosted by the cosmetic surgeons at Graper Harper Cosmetic Surgery in Charlotte, North Carolina, the Doc Dudes brings you interviews with insightful guests, expert tips from experienced medical professionals, and lots of laughs along the way. And now, here's Dr. Garrett Harper, Dr. Robert Graper, and Dr. Evan Zug, also known as the Doc Dudes.
Welcome to another episode of the Doc Dudes. This is Garrett Harper, along with Dr.
Robert Graper
and Dr.
Evan Zug.
All three board-certified plastic surgeons. Today, we are talking about fat transfer for the face and body. What it does, what can go wrong, other options that might be right for you. So we're going to kind of get into layman's terms here, right? I always love it whenever you've got a patient and you're discussing fat transfer with them, inevitably whoever is with them in the room, if it's the husband, the best friend, the sister, the mom, anybody, everybody always asks if they can donate. I mean, every single time, right? Every single time. So it's like if you are going to come in for a consultation, you bring somebody, I'm like willing to bet, I don't know, like a popsicle or something. I'll bet
all
something.
All out.
It's crazy.
In.
Yep. So Evan, Dr. Zug, to those of you who don't know Evan, talk to us a little bit, like what does it mean when somebody says, I'm interested in fat transfer? What does that even mean?
Yeah, so I mean, in simple terms, just keep it simple. When we're taking fat from another part of your body through liposuction, and we're processing that fat to remove any impurities. Okay. And so we just have pure fat, and then we inject that in an area that we're trying to improve, whether it can be facial for kind of improving the periorbital area. Okay. Most commonly for me, what I do a lot of here is a fat grafting to the hip dip area to just give a little bit of volume and more shape to the lower body. Yeah. And then breast is other great option for fat transfer.
Yeah, agreed. Dr. Graper, do you do any fat grafting? Talk just a little bit about how you've used fat in the face before, and do you still do it, or what do you prefer? Because I've seen a myriad in my, almost 20 years of plastic surgery. And, everybody used to get a facelift, and I'd be sitting down there and I'd be harvesting the fat out of the tummy, and then you'd give them 20 cc's and they'd put 10 cc's in each cheek. Right. I mean, almost just like blindly do it, right? Yeah. Every time.
Well, when I started with some of the specialties giants, Fritz Barton, Steve Bird, Sam Hamra, nobody did it. Right. And then in San Francisco, a guy named Tim Martin put out some gorgeous results and techniques that were very specific about how to do it. And I thought, I am doing this. This guy's results are amazing.
They really are.
You take all this time and you would bruise the face massively by doing so many injections because the techniques got to get fat.
Aliquots.
Yeah. I mean, each aliquot of fat has to be within 2 millimeters of blood supply or it dies. And then you get nothing or you get scarring. So I would frequently find my patients were all beat up, and 6 weeks later or 3 months later, you couldn't see it. Yeah. And so I've come down that what the ladies do with fillers works every time. Yeah. Much more predictable. And let's say, for instance, the fat grafting works, but it doesn't work evenly, or you don't like it as it turns out. It's wrong place, or even if it's in the right place, you just don't like what it looks like. It's hard to get out. Yeah. The fillers, a disadvantage is that they go away, and an advantage is they go away.
So what do you mean?
And you can dissolve them.
What do you mean by it doesn't work, right? Because we work in symmetry, right? So if you're doing a facelift and you're gonna put 10 cc's of fat in each cheek, what do you mean? Like they're not gonna get 10 cc's of fat there?
Right. I mean, if you put 10 cc's of fat, you're never getting pure fat. You always got it mixed with some amount of saline, which is your transfer solution and cleaning solution. And so maybe you're really only getting 5 cc's maybe in a 10 cc transfer. So it's going to dissolve. And what if 3 cc's takes on one side and 1.5 takes on the other?
Right.
Now you got an asymmetry. Do you have to add more on the other side? How do you know how much to put in? What if you don't even like it? You thought you'd like it, turns out you don't. With filler, you can put hyaluronidase in, which is an enzyme that dissolves hyaluronic acid.
Yeah.
It's gone. Problem solved. Or maybe you just give it time and it goes away in 1.5 years, 2 years.
Yeah.
Fat there, you don't have that flexibility. So in my hands, I'm a filler guy. I tighten the skin and let our ladies who are expert injectors put the volume in we know is going to work.
Right. What you get and you don't pitch a fit.
Yeah.
I mean,
and there are other people though. Tim Martin's results are still beautiful.
Yeah.
I mean, I have his paper on my desk.
Yeah, it's a great paper.
The way that he there's like 20 different injection sites that he
Right.
does when he does this.
Right.
And he's injecting anywhere from 50 to 70 cc's of fat into the face. And what I found is the best way to avoid those issues of fat resorption or asymmetry or contour irregularities is the areas where you get the best bang for your buck, or your temples or your cheeks or your lips. And then the other areas that he talks about, those can be really difficult to get a good result with.
Well, I felt like I remember, after he wrote that paper and everybody kind of adopted those techniques, I remember having the 20 different 1 cc syringes, right? And you just ad nauseum filling them and putting them right. And then it felt like there was a trend where everybody was saying, this is taking too long. I don't know that the results are as great in my hands as they may be in Dr. Martin's. And so I remember seeing people just taking 10 cc syringes and just going straight down to bone in the cheek and just injecting it. I mean, Rod Rourke did that. I mean, in front of everybody at a Baker Gordon symposium. It's like,
Doesn't surprise me.
That didn't seem very
physiologically going to work.
Yeah, it just didn't make sense. So
it's the same thing with fat transfer to other parts of the body.
Sure.
You really have to have a thoughtful, focused discussion with your patient about what the risks.
Well, the Brazilian butt lift. Tell me what y'all know about that, and how often does that look as good as you see in the journal?
So the BBL is out in 2025, and the ballet body's in.
What's that?
The ballet body is a more youthful but curvy shape to a female's body.
Yeah.
The lower body, the trunk.
No more
the
Kim
bottom
Kardashian.
is not
No
now.
more Megan Thee Stallion.
Yeah, none of that.
Man, I was just getting used to that, actually. So I have told people this. I have said, taking a bunch of fat, like high volume fat from all areas of your body, processing it, and then injecting it into your rear end, right? Because back in the day,
Put it in the trunk.
Dump it in the trunk. We used to put the fat at every level, right? You put it intramuscularly, you put it subcutaneously, you did all these things, and then people started getting injections into the venous system, which was resulting in fat embolism, death, things like that. So then they went and said, okay, only put the fat in the subcutaneous area. And then they went one step more and they were like, make sure you're using an ultrasound machine when you do that, right? I mean, the state of Florida has put regulations on how much fat you can inject into an area, how many of these procedures a doctor can do in a day, all sorts of things to try to make it safe. But what I've always kind of contended with was the rear end is made up of some of the strongest muscles in the human body, right? Gluteus maximus, medius, minimus. And so I think that fat can be used to help define, shape, or supplement like the hip dip areas where people have done what they need to try to build and hypertrophy those muscles. I also think when you, just like any muscle in your body, when you work it out and it gets bigger, the blood supply is going to improve. And I think it improves your chances of having successful fat grafting to the area as well. So I agree, Evan kind of pointed at, not many people are doing the dumpy trunk anymore. They actually want to have an athletic, and you still want curves, and I get it, but that's a much smaller volume of fat. And I've told people, we all read The Three Little Pigs, right? Like, take your time, do things the correct way, hypertrophy those muscles, work those muscles out. It's not just squats that you need to do. There's literally books and videos, and people have really spent a lot of time trying to make the best results possible through exercise. Now, there are physical limitations that every patient has. We all have the patient that just has super narrow hips, kind of a squared off body. And so we can do some liposuction to an area to try to bring that in. You can then use that fat to try to supplement things out laterally in the hip dip area to try to give them that kind of curve that everybody wants.
Peach.
And I think that those are good surgeries. Those are great surgeries. You can do it in conjunction with some of the cellulite treatments, like Evan's doing the Ovally treatments. You can use Renuvion back there. You can microneedle to help with the skin quality, get rid of any stretch marks, those types of things. So there's all sorts of therapies that you can, and I do think that they're additive though. I think if you just do one of them, I think you're going to get a good result, but not many of our patients come in here and they're looking for a good result, right? So I think you really got to kind of treat the whole scenario.
And that's hard for patients to understand too.
It totally is.
Because, a lot of these patients, you need to do cellulite reduction, you need to do liposuction, you need to do fat transfer, you need to do skin tightening to really get that result that they want.
Yeah. And I get a lot of people who come in who ask about fat grafting to their breasts, right? Which I think in certain volumes and in certain areas to the breasts, it can improve and it can be a great kind of adjunct procedure to do. I think just kind of, do you remember the Brava device?
Mm-hmm.
Oh my gosh. All right. For our listeners, there was a guy, was it the Massachusetts group or was it Cerletti in Philly or Pittsburgh, wherever they were? Somebody came up with basically,
the cone, the Madonna.
Right. It looked like so it looked like two pieces of Tupperware that you'd put on your breasts and then you'd hook it up to a machine.
I'd say party hats.
Right? Right.
Cones.
That's right. That would suck. And by sucking, it would draw your breast tissue out and almost
augment the blood supply.
Stretch them and augment the blood supply. And they'd wear this for like 23 hours a day for months before their fat grafting procedure.
And cut a hole in their mattress to put their breasts in.
Who's got such a big problem with implants?
And then you could only put 200 cc's in at a time, and you do it 2 or 3 times. It's like, why don't you just put an implant in?
And that's the other thing that people don't realize is that oftentimes because you can't just put as much fat as you want into an area, because I think Dr. Graper talked about it earlier. Those fat cells are going to live off of neighboring blood supply from cells that surround it. So, I mean, if you just put a glob like
a lake.
Yeah. Or if you just think of like an implant, right? Like, oh, here's an implant. Let's just put 200 cc's where you'd put the implant. If I just, put 200 cc's of fat into a pocket of a breast, it would all die.
Mm.
It would all die, and then it would get hard as a rock. It would calcify. It would, some of it would get absorbed, but then when the body can't absorb it, it ends up making it as hard as a brick, which is just not great. So I just want patients to know that there are limitations for fat transferring. There's also really great places to do fat transferring, and I know that you can do the back of the hands, and I think that that's a good area to do some fat grafting for people. And that's not to say that there's not other areas in the body where it can be a nice supplemental thing, but when you're talking about large volume stuff, I think you're just asking for problems with fat transfer.
And I think a lipo revision where, you've got a little over resection in one area and you'll take some from the adjacent mountain, if you will, and put it in the valley. That's a limited thing. That can work nicely. But these, 600 cc fat transplants.
I think is probably the most you can get for
a breast.
Like a cup size, maybe.
Yeah, maybe. And it depends on what they're working with to begin with, right? It also depends on if they've got more fatty tissue or glandular tissue. I mean, we've got some patients who have such glandular, dense breast tissue. The only place you're going to be able to put that fat is subcutaneously. And then it just like,
I just don't know why you'd ever
I don't
do
either.
that.
Yeah.
Have you ever done? I know you've done some fat grafting with
I used to
reconstruction
fat graft
patients.
every reconstruction patient that I did. And now I just don't have to do it. The implants are better.
That's better.
I mean, you can still do it. You'll still get the patient that's
Or you get a Poland syndrome.
Sure.
You can't put an implant high enough to get the volume.
right.
And so that might work. And when, where do you like it now where you would say that's my preferred technique?
Yeah, I mean, I did a Poland's patient a couple months ago, and we talked about maybe going back and doing some fat grafting, but we'll just put the implant in first and kind of see how things settle out. And she loves it. I mean, she is so happy. We didn't have to do any fat grafting, and I think that's really the implants have come a long way.
I mean, I was 100% on all of my breast reconstructions, and
never on an AUG.
never on an AUG.
Yeah, I've never needed it on an AUG.
Yeah, I mean, I've heard of people doing fat grafting at the same surgery as the mastectomy, and it just doesn't
Make any sense.
Oh, it just seems like
Kill
it's
the
going to
skin
be
flap
fraught with
off, too.
problems. That's right.
Just
Have major problems. Blood supply is already, not great, and then that's just going to increase your chances of having absorption and loss.
killing the skin flap off.
Yeah, that's exactly right. Yeah, that's exactly right. All right, so we talked about contouring areas is oftentimes because people don't realize that about the body and the abdomen, right? Nothing's flat. When people come in and they're like, oh, I want a flat stomach. You don't want a flat stomach. Like, that's weird looking, right? If it's truly flat, the abdomen, the human body, the buttocks, the lower back, all those areas are hills and valleys, and they're combinations of those things. So, I tell people oftentimes when they come in and say, I want my butt, to be more pronounced. I want it to look bigger. I feel like I just don't have it. I feel like I'm just flat back there. I'll tell them the most important component to their rejuvenation back there is liposuction around that area, right? And I just tell them you're basically having addition by subtraction, right? Like you're adding to the look of your buttocks and the shape of your buttocks by subtracting around it. And we can also use that leftover fat instead of throwing it away. We can use that to help kind of supplement some of the hip dip areas just to try to help with shape. But, I am not going in on people and just doing major volume BBLs to them anymore.
Yeah.
I think that's kind of running
I just don't think
favor.
Does it work?
I don't think it looks. Oh yeah.
You think in long term they?
I don't know how that's going to age in 15 years.
Yeah.
No, yeah, you do. Oh yeah.
I mean, I know,
Yeah,
but
you know, and here's another trick that I want patients to know about because this is kind of funny to me. I've always thought this was funny. I'm amazed at the people, the plastic surgeons that put before and afters up on Instagram or wherever you're doing, social media stuff, because the before for every Brazilian butt lift, the before is somebody standing up straight with their legs locked and their butt clenched, right? And so their muscles are pulled in. They've got the worst shape humanly possible, right? And they're like flat up against a wall, facing a wall. The after is always somebody after their lower back has been liposuctioned like crazy, right? And then the fat has been placed in their buttocks. And then the plastic surgeon takes a picture of them while they're on the table. They flex the bed to where it's in a jackknife position to where the butt's coming out straight at you. And you're looking down the barrel. So everything that gets further away from you gets more narrow and tapered, which just makes their lower back and their back look prettier than it really is anyways. And then they're going to put a bunch of like OR lights on it and probably lather some baby oil on there, right? Like their Puff Daddy, right? P. Diddy, sorry. And it's like, it's such a gimmick. I mean, the bruising, the swelling, the fluid that's both fat and kind of, the normal saline that's in there. All of that is in there, and they're in a totally different after photo, right? Even when they show, look how happy my patient is, it's always like the camera's on the floor looking up at their rear end, It's just tricks. Mm-hmm. It's like, it drives me crazy
like flashes.
That people take the bait on some of these things. And that's not to say that there aren't some really talented fat grafting people out there. There are. This happens to be one of those areas in plastic surgery where I think people saw a market where they could do it super easy because it doesn't take a very artistic eye to just liposuction the heck out of an area and then just kind of put the fat in. And so that has led to disasters being performed by non-licensed,
it's very difficult to do that well.
I totally agree.
It really is. I mean, you're sculpting someone's trunk and lower body. I mean, you're literally sculpting it out of basically a solid piece of stone, and you're trying to create a shape. It's difficult to do.
Right, but think about all the people who are going to non-board certified plastic surgeons and having this done. Think of the places like that where you're going to get this done by people that do not have the training, do not have the understanding, do not have,
You got to really dedicate your practice to it.
And that's great.
But I would ask patients to to see before and after pictures, and I don't want a 3-month picture. I want a 2-year picture. See how it endures.
I want a 10-year picture.
Yeah.
When you've completely created a structure out of fat, right? That's going to change according to what happens to that person as they age. That's exactly right.
Have y'all seen the this new procedure where they're infracturing your lower ribs to narrow the waist?
No.
I've seen, that was what Doderick had a 12th rib removed.
Did she really?
Yeah.
You always heard that about Janet Jackson.
I think it was at Baker Gordon this year. There was a talk on it.
That's wild. I mean, I just can't believe that that gets into body modification that I think is just, I think it's taken it too far. I think, I just don't know many people who want to improve their figure, want to restore their figure to what it was, that go that route. Like that's somebody who just has a problem. I mean, they're addicted to plastic surgery. They're addicted to a particular look, and they'll do whatever they can to try to get it. And thankfully, I don't see a lot of those patients, and I don't think a lot of them come to Graper Harper Cosmetic Surgery.
Yeah.
It's kind of a different thing. And then some of the complications we talked about, right? Fat absorption. You get necrosis of that fat where it becomes really hard, firm, almost brick-like. It can become calcified, which was always kind of a concern when you did it in the breast.
I have a friend in Miami who's basically built his practice on removing biopolymers and fat necrosis from BBLs.
Wow.
Ooh.
Wow. I bet there's
what are
money.
Biopolymers.
I think a lot of these patients
dead serious.
Come on.
Oh, I swear to God, when I was at Emory, there was like some crazy lady that from the streets that would take you to her hotel room, and she would inject Fix-A-Flat in your rear end.
We had silicone coming from Asia when we were in Dallas.
Yeah.
Yeah.
Oh my gosh.
Wild.
A lot of people do that.
Yep. Stay away from that. Save your money and let a board-certified plastic surgeon help you. Fix-A-Flat in a Ramada Inn off of
probably not a
La
good
Brea
idea.
Is probably not a great idea.
Unless they get a good salad bar.
That's right. That's right. All right. So we talked a little bit today about fat transfer. Hopefully we answered some questions. If you've got any more, please contact us. We'd love to chat with you about it and go over who's a great candidate for this. It's tailor-made. There's no doubt about it. But you may be a great candidate. So it's not that it's off the table, but we do want you to know that it's not front line, and a lot of people overpromise and underdeliver, and that's not the reputation we have either, which is great. If you've got other questions or topics you want us to cover, visit ghsurgery.com, click on the Doc Dudes from the homepage. There's a link to click to submit your questions and ideas. Subscribe to the Doc Dudes so you never miss an episode. New episodes drop the last Tuesday of each month. You'll find us on Apple, Spotify, YouTube, anywhere you listen to your favorite podcasts, as well as our website. Follow us on Instagram and Facebook to find out when new episodes drop. and other information about our practice. We appreciate you tuning in with us. I am Dr. Garrett Harper, along with
Robert Graper
and
Evan Zug.
peace out.